Okay. Hi everybody, I'm Tenessa Pinkerton, nurse practitioner with SSM Health St. Anthony's, and doing a Facebook Live today. I can give a couple minutes for people to jump on, and then we'll kind of go from there. Today's topic is basically healthcare 2020, getting your healthcare goals back on track. Today I really want to try to focus on routine annual exams, screenings, cancer screenings, things of that nature, really how to kind of go about doing that amidst the current pandemic and some of the options that are out there for patients right now. So getting started on that, the first question is, well, where do you start? I always recommend, first thing, take a step back and actually review your personal health status. That can include everything from, have you had an annual exam? Have you had some screenings this year? Which screenings have you actually had? Or, did you do maybe one or two, possibly back in January? I know a lot of people really like to start doing their annual exams either right after the first of the year or maybe in their birth month. So if you did everything in January and you're caught up, awesome. If you haven't had that chance, maybe you did something here or there because either perhaps maybe work offered certain screenings, or maybe you just had an opportunity to get one or two things done but not everything. So the first thing I would say is definitely take a look at your personal history, your personal annual exams, everything that you have done. Other thing to look at is, do you have a chronic illness that requires monitoring? And if you do, since COVID has hit and everything has kind of turned upside down, have you had any of those screenings that maybe you hadn't had completed before? Do you have appointments made, to follow up? I know a lot of appointments weren't necessarily canceled, but delayed and pushed forward and pushed forward and pushed forward. So just, dig out your appointment cards, look at your calendar, see if you've written something down, but really take a good look at what you've already done versus maybe what you still have to do, or, again, if you're all caught up or if you haven't done anything yet. Other thing to look at is to know your personal history, your risk factors in specific on that. Do you have a family history of breast cancer? Do you have a significant family history of colon cancer, significant history of diabetes, heart disease? Any of those things that may put you at higher risk and really make some of your screening tests even more important. Other things, if you yourself even have high blood pressure, or maybe it's in within your family, or if you've had maybe not colon cancer, but your last colonoscopy showed some polyps, that would definitely increase your risk and kind of bump up the need to get that screening performed. And so after you've kind of reviewed your history, your family history, and you know your risks, and you know what exams and screenings you've already had, then I would actually talk to your PCP, which is primary care provider, and if you're unsure, you're more than welcome always to stop in and ask me. But what screenings do you really need? And make a list of that. The next thing that I do say is put that plan together, and in that is make a list again of your completed visits or screenings, what might be left over, any chronic issues that you need to have rechecked, any other concerns or goals. Maybe during this time you've spent a lot of time outdoors and you've noticed a new skin spot, or something's changed, a mole has changed. Maybe perhaps, unfortunately, you gained some of the COVID-19, as we call it. I know I had a problem with that. So maybe weight loss might be a focus. Perhaps maybe your joint pain got worse, or maybe it even got better. Maybe you got to get out a little bit more and lost that weight instead of gained, which kudos to you if you did. Also in regards to medications, if you've made those dietary and lifestyle changes, lost weight, gotten out a little bit more and done, or focused perhaps a little bit more on your exercise and diet during this time, perhaps maybe your medications can even be adjusted. Regardless of whatever of that might or might not pertain to you, I highly recommend that you make a list. If you actually write it down on paper or in the computer, whatever is your preference, you can even put a note in your phone. Making a list really kind of helps any visit that you do make or any appointment that you do plan in advance and attend. It can actually streamline that so that you don't accidentally forget something, or that oh man, I forgot to ask. So it really kind of helps keep everything in check for you. The next thing on part of putting that plan together is to make the appointment. Most PCPs can order pretty much any screening test for you. Not all of them, of course, do the screenings, for instance, colonoscopies, things like that nature. Those will have to be done by perhaps another physician. Speak louder. And those might have to be done by another physician, specifically a gastroenterologist. If you have any chronic conditions that need monitoring, you definitely want to contact your specialist on that. If you have arthritis, if you have specific joint issues, you want to contact orthopedics on that, a cardiologist for sure, anything of that nature. If you haven't touched base with them since COVID, now's a good time to at least say, hey, it's been 3 months since my last checkup, or 6 months since my last checkup. I'm either doing okay, or I now have these concerns. Do I need to come in, or is it okay for me to continue and plan a future appointment? A question I get asked an awful lot, both by family, friends, and even my patients, is it really safe to come back into healthcare yet? And the answer to that is yes and no. It depends really on each individual person. Some patients are at greater risk of contracting COVID, and the risk is not worth some of the screenings that they need. On the other hand, some patients, even still in that high risk category, really have to have certain screenings in order to continue to be healthy and to continue to be, perhaps, for instance, cancer in remission. Those patients still need to follow up with their oncologist, keep those appointments, even do their treatments in order to keep things moving in the right direction. The cool thing about COVID, maybe it's a silver lining, always got to try to look at the bright side of things in that aspect, is that there are options even regarding a lot of these screenings. Definitely there's the in-person option. Sometimes with certain screenings it is necessary, for instance, pap smears, not that a lot of women still have to have those, but we do recommend them up until age 65. Mammograms, things like that, those are all in-person things that you're going to have to do. Another advantage to being in person is that it is generally a more thorough exam. As a provider, we not only rely on sight and sound and hearing and listening. Not here at all?
I think maybe a little louder if you can. But
Okay.
no, I can hear you.
Okay, no, that's fine. Sorry. And maybe perhaps, I'm sorry, I'm not talking very loud. Let's see, where did it go? It is usually the more thorough exam, simply because beyond sight and sound, we actually rely on touch and feel of certain things, actually laying hands on and examining that way. But for a large majority of things, we can actually do virtually, which is really pretty cool. And that platform in healthcare has just grown leaps and bounds, and we're learning so much about it, and it's really kind of a very exciting horizon for us, for sure. Perhaps also an in-person visit might be better for those that might not be as familiar with technology. Sometimes Zoom visits and different platforms for visits are a little bit harder to know. When we first started doing virtual visits, I listened to the nurses that were helping the patients, and man, they were just amazing as far as guiding them through how to get to what screen and what to do. Very proud of medicine in general for adapting to that and helping our patients to adapt to it as well. One of the other advantages of doing an in-person visit might include the fact that a lot of the screenings that might be required can actually be done there in the office. For instance, if your clinic or your provider has the capabilities to do things like lab work, if it's a cardiac visit, EKGs, x-rays, anything of that nature, it's kind of more like a one-stop shop idea. So versus doing a virtual visit and then coming in for the lab work, you could possibly be able to arrange everything all in one day. I would make a recommendation on that if that might be your plan, that if you're going for your annual exam in specific, talk to the scheduler when you call to see if perhaps maybe you could get an early morning visit. That way you can be fasted and not have anything to eat or drink at least 8 hours before your appointment. So that way if you're going to have some labs drawn, you can have it done right then at that day versus having to plan another day to come back just because we haven't been fasted. So just a little tip there. Virtual visits as an option. Like I said before, there's a lot of even screenings that can be done virtually. An annual Medicare wellness exam has an awful lot of screenings that we do virtually. Many mental exams for cognition. We even have patients do the sit to stand and mobility. So there's an awful lot really that can actually be done virtually. Skin screening or skin checks can be done virtually. And then, another thing, really to focus on depression screenings. That's really important, especially right now. Definitely seeing some mental health problems rear its head at this point in time, and want to be screening patients for that. So that's another thing that could definitely be done easily online. At the very least, online you can at least discuss your concerns with your provider and then make a plan for more in-person visits or whatever else it is that you need to do from there. Another thing regarding safety that I really highly recommend is to be aware of your community situation regarding COVID right now. In specific, is it a moderate, high, or low risk area? The OSDH website, that's the Oklahoma State Department of Health website, that is where the COVID-19 alert system is. That's the picture that, or the map that Governor Stitt and his crew had worked on that depicts by county what risk level we might be in currently. And I looked this morning, Oklahoma County is currently considered a moderate risk county. Being able to see that might be able to help you decide whether or not the risk of going out somewhere in person is something that you would choose to do, or if it's something that you might want to seek possibly the virtual aspect of that care. I also recommend, if you go to that website, you can even sign up for alerts on there. There's tons of different alerts from many different aspects on the Oklahoma state government websites there. It's pretty cool. I didn't know that you could sign up for all of that, but it was pretty interesting to see this morning. Definitely recommend to follow the CDC recommendations to help better protect yourself and others. That's definitely from wearing the masks hand sanitizing, social distancing as much as possible, and when you can't, definitely wear a mask if you can't do the social distancing. You know, regarding safety and making that decision, I also 100% recommend that you talk with your provider and really kind of talk that out, whether it's the nursing staff or, you know, if you happen to have, I know most of the larger entities such as SSM Health, Integris, and Mercy all run off of Epic, and that has a My Chart option in there, and you're able to send your provider messages through My Chart. So if you don't know how to use that, I would highly recommend that you call the clinic or ask someone if they might be able to show you how to do that, because it's a really convenient way for you to actually have kind of a quick conversation with your healthcare provider. I'm just really excited about all of the innovation that comes from that, and being able to, you know, make those appointments and ask questions and really converse with patients even on that platform has really been awesome. And being able to incorporate that in everyday healthcare in the future, I think is going to really improve a lot of things. On the flip side of this, you have to think about things that, you know, can it be delayed? And yes, absolutely, there are many screenings that can be delayed. However, the important part of that is that you can delay it, but don't forget it. Follow-up is absolutely essential if you're going to delay some screenings. For instance, Pap smears for women. They're about every the recommendation right now is every 3 to 5 years if your previous ones have been normal, up until age 65. So you can kind of push that off a little bit if you need to here or there, depending on what your need is. But if you've had a history of cervical cancer or something else that is worrisome, maybe some new onset of symptoms, then definitely don't delay that. That would be something that, cervical cancer, if caught early, can be survivable, but if not, it's a pretty bad one to let go. Mammograms, much the same way. If you don't have a history of breast cancer in your family, if you don't have any lumps that you know of, no symptoms and no current worries, then, pushing it back a month or 2 months might be completely feasible. Colonoscopies, another thing with that, again, very important test. Definitely don't forget it. If you had polyps previously, or if you have a history of colon cancer, then you don't really want to delay that as much as possible. Try to keep, within your usual schedule for that. Definitely have to, again, weigh the risks and benefits and make the choice that's right for you, but making sure that you actually get those done is definitely essential. And something about colonoscopies in particular, if you happen to be one of the lucky ones without a family history and no symptoms, something like Cologuard might be an option for you. That's the one you've probably seen on TV, where they actually send the test kit to your house, and you give them the specimen and send it back, and then they test for some DNA and things like that. Lots of options to discuss with your provider. Definitely want to do that. Some common screenings that are really, really extremely important, blood pressure screening. If you happen to have a monitor at home, you can even do that yourself. And I would always recommend, much like I said earlier, to make a list so you don't forget. Take the time to write down your blood pressures, here and there, so that you can kind of get an average and see how your blood pressure has been running, so that if you do a virtual visit versus going in person, you have some material to discuss with your provider. Again, the colon cancer, cervical cancer until age 65, breast cancer, bone density. That's another one that a lot of people don't think about and think it might be completely benign. And, I'll just forget about that. But falling and fracturing a bone can really be life-changing. and very detrimental. So you want to definitely do a bone density scan if it's time for you to do that. Again, it's one that you could certainly push out a few months here or there, but as we said earlier, you can delay, but don't forget it. So follow-up is key. I think we mentioned the depression screenings, that's something that could be virtual. Lung cancer, anybody age 55 to 80 with a history of 30 pack per year smoking, or if you've recently quit in the last 15 years or you're currently smoking, lung cancer screenings are, again, one of those essential things that definitely need to be done. Skin cancer checks, that could be something that's done virtually. Lab work, all of those things, looking at your blood counts, your metabolic panels, your lipid panels, your diabetic screenings, specifically hepatitis C for anybody born between the year 1945 and 1965 is important, as well as HIV. All of those types of basic screenings are something that probably could be delayed if you're not one of the higher risk people. Again, everybody's different, but as we said before, don't forget about it. Another screening that I kind of wanted to add in there right now that's going on, SSM actually offers the ability for you to do a COVID concern screening through our Zipnosis platform. I don't know if some of the other entities are doing it or not, but I know that through SSM you can do that. You can actually go through Zipnosis and say that you have a COVID concern, and you can receive a screening, and we can actually direct you as to whether or not you need to pursue further testing. And as far as testing goes, SSM also does testing, broad-based testing, so you can actually call. The number is 4052725513 and set up an appointment for a drive-through testing. Right now, our turnaround times are about 48 hours for the swab and 24 hours for the IgG or blood test. The blood test usually isn't done unless you've already been exposed or have had the illness previously. Otherwise, we just usually do the swab. But you're welcome to call that number if you have any symptoms or if you would like to receive testing. I've had many patients that tested just because they wanted to know and did find out that they were actually positive for COVID. So definitely encourage testing if you're interested in doing that. Also, I believe you can call 211. We'll give you a list of the nearest testing sites so that you can choose from that as well. Kind of an overview of the considerations. Again, you really need to take into account that early detection actually can make a huge difference. The later stages of cancer can, unfortunately cost a life, or be completely life-changing. Same thing with chronic diseases. Elevated blood pressures for a long period of time can actually end up damaging your organs, and that's irreversible. So very important, to understand that early detection does make a huge difference, and that's one of the reasons that we really kind of push the health promotion and prevention aspect of healthcare right now, because we're seeing so many people unfortunately suffer from the ill effects of not being in the preventative mode. Again, every community is different, so you want to be aware of what your community is like. If you happen to live in a retirement community or in a long-term care facility, something of that nature, definitely want to know, are you able to leave the facility and come back? What is offered there? Do they have providers that maybe can come and see you? Can you do virtual visits? Again, Oklahoma County is considered at moderate risk right now. That means our numbers are pretty high. Just be kind of aware of be aware of the community that your provider is in. That way you can kind of make those decisions. Do I want to travel to that area? Do I not want to travel to that area? Also, again, those alternative options, anything from virtual visits to self-collection kits and tests, much like we talked about the Cologuard, that's an option. The virtual skin checks is an option. Definitely want to repeat again and again. You can delay, but don't forget. Much like we talked about, writing a list down to make sure that you don't forget something at an appointment. I highly recommend that you put it in your phone calendar, write it on your calendar, whatever is your preference on that aspect. But perhaps, if you usually get your annual exam done in July and you couldn't get it done in July, if it's safe enough to wait for you, depending on your history, if it's safe enough for you to wait a couple of months, then go ahead and put in your, if you haven't already scheduled the appointment, go ahead and put that reminder on your calendar or in your phone. Hey, this month, don't forget to schedule things, because you certainly don't want to let it lapse and then have an unfortunate outcome in that. I'm happy to say that most facilities are taking extra steps, extra precautions to keep you safe. And I know SSM certainly is. Everything from temperature checks to wearing masks, hand sanitizers everywhere, really being vigilant to keep patients safe. Although we do want you to come in and get these things done, and you may need to have everybody who needs an elective surgery or what we call elective procedures, things of that nature. Those are elective for sure, but still they may be the difference between hurting every day and not. So for patients who need to get those done, we're definitely taking extra precautions, even for basic clinic visits, to keep everybody safe. Again, look at the CDC website to follow the guidelines for yourself, to protect yourself and others, extra protection there, anything that you can do. And then, let's see, also on the Oklahoma State Department of Health website, they generally follow the CDC's guidelines on that, but they do actually have even some steps that you can take if perhaps maybe waiting isn't an option for you. As always, and like we talked about earlier, talk to your provider. We are definitely certainly listening right now. Got our listening ears open for sure. We're trying new and innovative ways to care for our patients, to make sure that you get the health care that you need, whether it be at home or in person, and to keep you safe while doing that. So just reach out to your provider so that you can have those discussions. Finally, I always say, how can I help? If you've ever been to one of my conferences or presentations before, I usually have a picture of a happy little panda that says, I'm here to help. Things that I can do in particular here at the center and for you is I can provide primary care services. I can do referrals if need be. I'm also, one of the aspects that I offer is that one-on-one kind of health coach, life coach options. I'm also working on developing a format for individualized healthcare plans, so I hope to be bringing that to you soon as well to offer, and have a tangible example so you can actually see what that might entail. And then always, I'm here to be a resource to you. If you need any questions or anything, I'm happy to help you as much as I possibly can. Do we have?
So Tina wants to know if you have any information about flu shots.
Okay, flu shots, as in, I know that I will be getting some flu shots that I will be able to distribute. I look to get them probably end of September, 1st of October. And definitely highly recommend that you do still get your flu shot. Upcoming flu season paired with COVID is a pretty daunting thought for healthcare providers in general. We certainly don't want a lot of people to accidentally have both if they can keep from it. And if you can, it's just another way to keep yourself the healthiest possible. So I will have flu shots. I will announce those as soon as I get them in, and announce how we can go about dispersing those. Okay, all right. If you guys think of anything else, feel free. Also, and I didn't bring it with me, but normally if you come to one of my presentations, I usually do a drawing. So if you'll hit like or say hi, we'll go back and I'll review all of the names that popped on here, and after a few days, then I'll do a drawing, and you'll get a little prize that'll be at the front desk waiting for you. Okay? Thanks, and y'all have a great day. Stay safe and healthy.